Madam President, I have the honour to introduce the pre-recorded statement delivered by His Excellency Mr. Christian Ntsay, Prime Minister of the Republic of Madagascar, at the 75th United Nations General Assembly General Debate. Thank you.
Monsieur le Président,
Mr. President, Excellencies, ladies and gentlemen, heads of state and government, Mr. Secretary General, ladies and gentlemen. Madagascar is honoured as I take the floor to address our august assembly on behalf of His Excellency Mr. Andry Rajoelina, President of the Republic of Madagascar, on behalf of the people of Madagascar and personally, and this on the occasion of the 75th session of the General Assembly of our organisation, the United Nations, during which we are celebrating its 75th anniversary as well. Mr. President, I would like to express my sincere congratulations on your election and wish you every success in the conduct of this session, which is an unusual one, due to the highly symbolic anniversary celebration that I've just mentioned, and also due to the extraordinary situation of the COVID-19 pandemic, which the entire world is currently facing and fighting. I would also like to reiterate my support for our Secretary General and encourage him in his solemn mission in the service of Member States. Excellencies, ladies and gentlemen, given the severity of the global spread of the COVID-19 pandemic and its immeasurable impacts on all of humanity, with, among other things, nearly 1 million deaths globally, including 216 in my own country, I would like to convey from this rostrum a message of solidarity, of compassion and of encouragement to all the nations and peoples of the world. We are celebrating the 75th anniversary of the United Nations in unusual circumstances, at a distance from one another. And we must take this sign of the fragility of the world as an opportunity to come together in our shared faith in our collective future, and to come together around the human values of shared peace and prosperity that drive our organisation. Given the uncertainty permeating our shared planet and the need to accept that individual efforts and individualistic achievements have reached their limits of common sense and effectiveness, we should take note of those most important shared values of our organisation, such as unity, solidarity among peoples, and cooperation among nations. We must therefore reaffirm our commitment to what unites us and reject what divides us. It is through solidarity and cooperation that we will be able to overcome the COVID-19 pandemic, and this is the form and the tangible beneficial meaning that we can give to and also receive from multilateralism. Excellencies, ladies and gentlemen, as at the beginning of its history 75 years ago, the immediate challenges facing the United Nations are immense in this anniversary year. COVID-19, which is a threat to us all, does not distinguish based on age, gender, religion or race. The deep-rooted economic imbalances and social inequalities that we have continuously fought in our organisation have been exacerbated by the health crisis. The situation in the sphere of peace, international security and human rights has further deteriorated in some parts of the world. Several national elections have had to be delayed, which destabilizes democracy. The economic crisis has become widespread, and the resulting fragility in society has been substantially worsened for millions of our people. The unexpected emergence and virulence of COVID-19 have exposed our collective shortcomings in the face of a shared threat. This requires us to rethink the scope and the reach of the multilateralism that we are promoting, so that every country around the world has a genuine shared bedrock of resilience, along with the appropriate tools to address multifaceted shocks such as COVID-19. And the aim of all of this is so that we don't undermine decades of collective work within our organisation as well as within the various regional communities. Excellencies, ladies and gentlemen, Madagascar has addressed the pandemic as much as its resources and capacities allow, raising awareness and mobilising to protect its population and to bolster the country's resilience to the COVID-19 crisis. Since the official announcement of the COVID-19 pandemic in Madagascar in March 2020, our country has quickly implemented a multi-sectoral response strategy to better cope with the social, economic and environmental challenges and impacts. The country's response is based on three main goals: curbing the spread of COVID-19 to stem the pandemic, assisting vulnerable people and effectively meeting their essential needs, and protecting and stimulating the economy, maintaining human capital and facilitating a recovery. With this in mind, our efforts are focused on establishing and strengthening a governance structure for the pandemic response, strengthening social protection measures, and supporting economic resilience. This response got underway quickly on the basis of several major activities, such as the establishment of the Operational Command Centre at the national and regional levels, and the development of multiple social assistance programmes to support families affected by the public health crisis, as well as vulnerable families. What's more, the state decided to help the private sector maintain employment and the means of production through unprecedented tax relief, helping the sectors that have been affected to better cope with the consequences of the health crisis, with aid packages such as providing seeds and fertilizer for farmers, giving food parcels to some affected workers, ordering more than 5 million masks from free export companies and small private enterprises, launching a major public infrastructure investment project, and support for research and innovation to produce COVID organics, or CVO, an improved traditional remedy for effectively combating COVID-19. Madagascar has truly stood out with CVO, which is the result of major research done by the Malagasy Applied Research Institute, IMRA, given Madagascar's recognition as a haven of global biodiversity, with a very rich and varied global pharmacopoeia. CVO, which is preventive and curative, has undoubtedly allowed Madagascar to avoid a human tragedy similar to what has unfortunately happened in many countries around the world with the spread of COVID-19, because the country distributed this remedy en masse in conjunction with the many social and public health measures it adopted. Madagascar has not faced this challenge alone. It has benefited from the vital and substantial support of the international community and scientists from all over the world. And here I would like to convey to all of them the profound gratitude of the government and people of Madagascar. Lastly, on behalf of His Excellency Mr. Andry Rajoelina, President of the Republic, I would like to pay particular tribute to all of Madagascar's medical personnel, to the defence and security forces, to all the volunteers, and all the essential service workers in the public and private sectors for the sacrifice and services that they have worked hard to provide by giving care and treatment to the sick and protecting our fellow citizens and their property, sometimes risking their own lives in the process. The results we have achieved show that Madagascar has a handle on the spread of COVID-19 because the recovery rate of confirmed cases is 93%, while mortality is at 1.2%. The entire people of Madagascar also deserve our sincere gratitude for their conscientious and calm behaviour during this difficult time, and for the sacrifice and patriotism that they have demonstrated in this difficult moment in our history and the history of every other country around the world. Excellencies, ladies and gentlemen, Madagascar considers it urgent that we make up for lost time in our collective thinking and action on the impacts of COVID-19. With this in mind, it is essential now that we come up with and promote a new concept with new innovative response instruments that promote global, regional and local initiatives for the production of medical outputs, including medicines and vaccines. We must strengthen international cooperation in the area of health to make the most of the comparative advantages of each country, increasing the number of models that are available and adapted to countries' levels of technology and innovation, and promoting universal access to innovative practices and scientific data. And we must establish mechanisms to finance healthcare systems. Given the global health challenge caused by COVID-19, these proposals will only be feasible with unprecedented cooperation between nations, the scientific and medical research community, the pharmaceutical industry, and multilateral partners. Excellencies, ladies and gentlemen, Madagascar intends to rapidly catch up the delay in its development. As part of this effort, major priority initiatives have been launched in several areas, such as strengthening the fight against corruption, including in the public administration. As guarantees of good governance, the security and justice sectors have also been strengthened. Despite the impact of COVID-19 on our country's resources, respect for the rule of law and the promotion of responsible democracy mean that we will organise elections for the Senate in December 2020, since the Senators' terms come to an end in January 2021. The question of economic development and social progress remains one of our country's priorities because only shared prosperity can have a virtuous effect on the social well-being of our people and also provide a better future for our children. Today, the international community stands alongside us as a partner in all that we are doing to overcome the major development challenges facing Madagascar. I would like to take this opportunity to thank our partners for their full commitment to Madagascar and its people. Excellencies, ladies and gentlemen, the COVID-19 pandemic has exposed the limits of multilateralism in terms of cooperation in the sphere of health and healthcare, and it is essential that we make corrections in the many important different areas that I have mentioned already. We need to do this so that achieving the goals of the 2030 Agenda is not entirely jeopardized by the unexpected effects of the pandemic. In view of our shared challenges, Madagascar calls today for a new universal multilateral initiative through the adoption of a global post-COVID agenda under the banner of the United Nations. This initiative, which could be time-limited, would aim to better diversify and coordinate all our multilateral commitments and actions to respond to the major socio-economic risks brought about by the current health crisis, in particular for the most vulnerable economies. This approach, which we want to be a more focused and dynamic one, will help us restore confidence in ourselves and breathe new life into the ideals of solidarity and multilateralism that bring us together in our organisation. Now, more than in the past, it is the responsibility of each member state of our organisation to hold fast to the ideals of the Charter upon which the UN was built, and to strengthen its status as the ideal framework for international cooperation to resolve major global problems such as COVID-19. This will be essential if we want to build the United Nations we need to bring about the future we want. I wish every success to the work of this 75th session, and I thank you for your attention.